This is the hip car, the hip controlled articular rotation. Something that's commonly missed for people performing this is they utilize a little too much side bending and hiking up of their hip and their pelvis towards their rib cage because they're not utilizing ranges that are actually available to them. So the whole point of this drill is to bring more nutrients to this joint and do healthy movements and get some tissues stimulated and get my brain thinking about that area a little bit more. So I have a Peloton right here, so I'm gonna be holding this. If I had broomsticks or anything that weren't gonna slide around, I could hold two of them, or I can just hold one, a golf club, anything works. It's gonna keep you stationary. I could hold the squat rack as well. So I'm gonna use this leg here. I'm gonna bring this leg up and slowly start rotating it so my foot goes up towards the ceiling. This is called external rotation and flexion all at the same time. I'm going to explore that range and not allow my back to curl under to pretend I'm getting higher. I'm just trying to keep this nice and locked. So now I'm at this range. I've done a lot of cars, so I actually have to, when I go out, I'm going to slowly start bringing my leg down because I lack internal rotation here. So my knee is going to go down as my foot goes up. And again, I'm trying to not shift my body weight as much. And then my leg is now behind me, my hamstring is stimulated, my glute is turning on, and then I'm gonna flip it and reverse it. So as I come out and around, my knee is gonna point down towards the ground the best it can, my foot goes up towards the ceiling, then my foot starts to come towards the midline, back and over, externally rotate, and then back down. From the side, what that will look like, I'll use two hands here. You'll see how limited I am. As I come up and around, first I'm into external rotation and flexion. I'm gonna windshield wiper my leg open the best I can without turning towards you. I'm gonna flip my foot up, drop my knee down, feel a lot on the outside of my hip, bring my leg back behind me the best I can without arching my back, so it won't look like that. I'm staying pretty locked, kick back, up and over, back around, and down. This is a drill to be performing for roughly 1 to 2 minutes daily. This is a very healthy drill to be doing.